How do I know if I have a yeast infection?
Do I have to go to the doctor? Should I use Monistat 1, 3, or 7?
Should I tell my boyfriend? Can he
Why
catch
do I
it?
get yeast infections so often?
Why is it called a yeast infection?
Can I use Monistat if I'm pregnant?
Why didn't Vagisil clear up my infection?
What should I do if it doesn't clear
Do
up?
antibiotics cause yeast infections?
I
tell my
know if I
boyfriend?
have a yeast Vagisil clear up my infection.
So many women are confused and embarrassed about their vaginal health. In fact, a recent survey shows just how confused you are, specifically about yeast infections. So I'm working with the Monistat brand to help clear up that confusion, empower you to get the right information and to cure the yeast infection if that's what you have. Yeast infections are really common. That's why I'm here, because 50% of you are going to chat rooms to find out what to do about your yeast infection. So why don't we talk? The dreaded yeast infection. A yeast infection is an overgrowth of what actually can be normally occurring candida or yeast fungal elements in the vaginal area. There are a lot of triggers for yeast infections, everything from antibiotic use to pregnancy, stress, and of course hygiene. It's contributed to by an overall less healthy or less optimally healthy vaginal environment. It can cause intense burning, irritation, itching, and changes in discharge. A couple of things you can remember to keep yourself from getting a yeast infection are to change out of damp or wet clothing as soon as possible. Wear loose-fitting cotton underpants, and I know you love your thong, but you could try a boy short. Change sanitary napkins as frequently as possible. And I do recommend that you see a doctor, or at least talk to your doctor, if this is your first vaginal yeast infection. So we did this survey, and almost half of those who said they had had a yeast infection reached for a product that controls symptoms but does not cure the yeast infection. There are external symptom relief creams like Vagisil that will help with symptoms, but they won't cure the infection. There are two ways to cure a yeast infection: vaginally or topically, and orally or systemically. Prescription oral or systemic therapies can cure a yeast infection, but because they need to be absorbed into your bloodstream, they can take longer to achieve symptom relief, 24 to 48 hours. Why not reach for something and put the medicine where the problem is? That's exactly what Monistat does. Monistat puts that cure where the yeast infection is, topically, vaginally. 38% of you actually think that you have to come into the doctor and get a prescription to cure a yeast infection, which actually is not true. And I love to see you and answer your questions, but a lot of this stuff can be taken care of by yourself. If you're in good health and you're pretty sure this is a yeast infection, it's a great idea to use an over-the-counter product like Monistat to start the curing immediately. I do recommend you contact your healthcare provider if this is your first yeast infection, just to go over any treatment options, any other medications you may be taking, and to figure out what's going to be the best course of action. What about sex? I think if you have a yeast infection, you should avoid the activities that bother it. Treat the yeast infection. Let the yeast infection get better. Give your vagina a rest. Then you can get back to your activities. It's not a disability, it's a yeast infection. Monistat has a really clear and long-term record of success. It's the #1 recommended brand for a reason. It was developed by the inventor of myconazole, and we know it works. The truth is, there's no better over-the-counter cure than Monistat.